see the horse from different perspectives, from behind, from in front, and from the side. Horses adapt in many different ways to lameness, depending on the source of pain, its severity, the individual's response to pain, and the type of pathological abnormality causing lameness. And we therefore need this broad spectrum, 0 to 8, of grades that we can assign to a lame horse. And because there is often more than one source of pain causing lameness, we need to be able to grade the lameness accurately after each diagnostic anesthetic technique that we use. Otherwise, there is potential to miss significant improvement. And I would consider if there is less than 70% improvement after diagnostic anesthesia, it indicates that there is probably an additional source of pain. So the horse on the right had a right hind limb lameness, and note also that the tail is being carried to the right. So this is a good example of a horse which had a left hind limb lameness, which was graded at baseline as 6 out of 8. Following plantar nerve blocks performed at the base of the proximal sesamoid bones, the lameness was improved to grade 4 out of 8. And that was associated with an injury of the lateral oblique sesamoidean ligament. We saw no further change in the lameness after a low 4-point block, but perineural anesthesia of the deep branch of the lateral plantar nerve produced further improvement to grade 2 out of 8. This improvement was associated with proximal suspensory desmopathy. The residual lameness was abolished by intra-articular anesthesia of the tarsometatarsal joint, and we can see that there is a fracture of the third tarsal bone. So this emphasizes the need to grade the lameness after each diagnostic anesthetic technique and to not be satisfied with only partial improvement in the lameness, because if you are, you may miss significant lesions. We may need to see the horse moving on the lunge, and I believe that this is preferable to the horse trotting in a circle because it is easier to assess how the horse is holding its body, which may be an adaptation to pain. Frequently, a horse with hind limb lameness will have reduced range of motion of the thoracolumbar-sacral region, reduced swing of the tail, and may show different trunk lean comparing the left and the right reins. A normal horse will have a symmetrical trunk lean on the left and right reins, whereas with a lame horse, there may be greater trunk lean on one rein compared with another. I also want to evaluate the excursion of the inside hind limb. We can see that this horse is leaning inwards, its head is turned to the outside, and the inside right hind limb is crossing in under the trunk during protraction towards the contralateral left forelimb. And this is an adaptation